I grew up with a lot of allergies, asthma, and eczema myself. I originally wanted to be a surgeon, but you can't blow your nose during surgery. So I was very fortunate during medical school to have met some nationally known allergists, learned about their practice and enjoyed it. I specialize in food allergies, both the types of food allergies that cause anaphylaxis as well as eosinophilic esophagitis. I also take care of the whole patient. We take care of patients with asthma, eczema, which is a skin condition, the typical nose allergies that people get in the spring, summer, fall from hay fever, or allergies from cats and dogs. So we take care of basically every allergic disease that there is. Yeah, the first visit is super important. The best part of the first visit is get to know the patient as a person, to understand that they have probably more than one disease that they want to talk about that day. So always make sure I set an agenda and figure out all the different things that people want to cover. So the visit, always thinking, if you have a diagnosis, I want to make sure that that diagnosis is correct. And if you have something that's going on that nobody's been able to diagnose, that's also my goal, is to help work towards figuring out what's going on. I always like to reassess people with diagnoses already. Sometimes they have that diagnosis and we'll keep on the path and make sure the treatment is optimized. But also, if you come in and you hear me asking questions that sound like maybe I'm not allergic, I'm trying to figure out if you aren't allergic, because that'd be really nice. Being allergic to one thing is not fun, and being allergic to 2 or 3 is even worse. Let's, again, find out what you're allergic to and what you're not. One of my favorite things is actually tell people what they're not allergic to. Sometimes people come in thinking they're allergic to 3 or 4 foods, and they may be allergic to one, but probably aren't allergic to all 3 or 4. So that's one option. That's always exciting. We can often do that the first day. In terms of longitudinal follow-up, some of the diseases we see, like patients with eczema or asthma, do take a while to get better. We can see significant improvement after the first visit, but that long-term relationship is the other reason I think allergy is a great specialty for me.